Good evening, everyone, and welcome. My name is Stephanie Thompson. I am the National Consumer Partnerships Manager at the National Mental Health Consumer Alliance. I have the privilege of emceeing today's webinar in our monthly series, Consumer-Led Conversations, hosted by us, the Alliance. I'll begin by acknowledging the traditional custodians of the many lands that we are connecting from today. I'm presenting from the lands of the Yagara and Turrbal people in Mianjin, also known as Brisbane. I pay my deepest respects to the elders past, present, and extend that respect to all Aboriginal and Torres Strait Islander peoples joining us today. This acknowledgement is not simply a formality, it is a recognition of sovereignty that was never ceded. These were and always will be Aboriginal and Torres Strait Islander lands. It is also a recognition that long before our mental health systems were built, First Nations peoples held systems of care, healing, and collective well-being. Systems grounded in kinship, in culture, in land, and in spirit. We are proud to honour our partnership with the Indigenous Australians Lived Experience Centre and the leadership of our First Nation board members. Their guidance ensures our work is not only informed by lived experience, but also by cultural authority and the principle of self-determination. I invite us all to hold that in mind, that true healing and justice in mental health must be built on truth-telling, cultural safety, and respect for Indigenous ways of knowing, being, and doing. Knowledge that has cared for this land for more than 65,000 years and has been passed down through the longest living culture in the world. I think it already popped up, but you'll see a survey on your screen where you can tell us what country you are joining from. Today's consumer-led conversations bring together the Western Australian and Victorian consumer advisory groups, communities of people who carry lived experience not as a burden, but as a source of truth, insight, and leadership. This space exists because our voices matter, our stories matter, and the systems that shape our lives cannot be transformed without us. In a second, you'll see another survey pop up because we'd love to know why you've decided to join us today and what brought you here. This evening, we'll also have a peer worker available, Ash Watson, who will be available if any of the content shared today causes any distress or uncomfortable feelings. If you want to say a quick hello, Ash.
Yeah, hi everybody. I'm really excited to be here, part of this. But yeah, do reach out if anything comes up and you need a chat. Thank you.
Thanks. So we're going to hear first from the Western Australian Consumer Advisory Group, who have been working on something that may sound very technical at first, but is deeply human. They've been trying to answer the simple question, why is it still so hard for consumers to access peer workers when we need them most? Then we'll hear from the Victorian CAG, who will take us into another deeply felt truth, loneliness. Not the kind we blame ourselves for, but the kind produced by the world around us. Loneliness is shaped by insecure income, unstable housing, and the loss of community spaces. Then we'll have some time at the end for some questions. So if something springs to mind, feel free to use the Q&A function and we'll come back to them at the end. And with that, I would like to introduce Martha and Ava from the WA CAG to begin sharing their work.
Hello everyone, thank you for joining. Today our presentation is Quality Quantitative Data to Support Consumer Advocacy. I just first want to do an acknowledgement of country. We wish to acknowledge the traditional custodians of the land, waterways and skies we are broadcasting from today, the Wajak people and their elders past and present. Sovereignty was never ceded in Australia, and this is and always will be Aboriginal and Torres Strait Islander land. Who are we? So we have Justine Campredge, she, her, the chair, Joanne Khan, she, her, Carly Shears, she, her, Martha Van Rees, she, her, Ava O'Neill, me, she, her, Sheila he, Kush Rathor, he, him, Jen Harlan, she, her, Sophie Steinmeier, she, her, Naomi Millett, she, her, and Juanita Cruzes. The planned outcomes from this webinar is to share our practical steps towards quantifying the lived experience workforce. And I just want to do a bit of a recognition of lived experience. So we remember those who have gone before, those who have led and are leading the way, those who are no longer with us, those who are still finding their way through distress or locked in systems of oppression, and those of us who are in this room. We are brought together by shared experiences and are unified by hope. I'll pass on to Martha.
I'd like to introduce our 5 whys. Our problem is consumers do not have enough access to lived experience, peer workers, advocates, and leaders when they need them. And because of this, peer workers are employed on an ad hoc basis because services have no obligation to employ peers, and there is no data on where and how peers are employed because no one is collecting the data, because lived experience peer workers have no separate coding in occupational data. So that we can have lived experience peer roles in contracts for commissioning, procurement, grant applications, or other funding mechanisms. Okay, so our solution is to track the growth and distribution of the peer workforce and hold systems accountable for the inclusion of peers through quantitative data mechanisms.
In Australia, the most reliable data on occupations is collected by the Australian Government, Australian Taxation Office, and the Australian Bureau of Statistics. These organisations use and maintain a system called the Occupation Standard Classification for Australia, OSCA. So OSCA is the list that says what occupations can be put in your tax form. It is also used by government departments for contracts and other compliance mechanisms.
So OSCA has many uses. It provides clear definitions of occupations and their tasks to develop professional standards. It helps define career pathways and training programs to meet industry and regulatory standards, and it supports government decisions on vocational education and training, known as VET.
So other uses is it's used to track employment trends and workforce demographics, offers a standardized way to describe occupations, which supports evidence-based cases for workforce development and training grants. And the other use is provides data that helps identify skills and shortages and plans for the future labour needs.
Okay, so this is the timeline from the ABS maintenance team and about when and how changes to OSCA will take place over 2 major occupational updates. So the 2 updates will take place in 2027 and 2029, and these are our 2 major opportunities to change.
Thanks, Naomi. Here we go. And the results from searching what's already in the OSCA database, there are actually no results for the words lived experience in terms of an occupation. And there's one result for an occupation that includes the word peer. And this is found only as a specialisation of a mental health worker, which limits actually the mental health worker to a mental health recovery peer support worker. And what have we done so far? So we've had some communication with the ABS and the OSCA team, and this is an email response back from them. Saying that they have added the issue to their priorities list for consideration as part of their upcoming occupation level updates in 2007, 27 and 29. If they're able to find supportive data within the 2021 census, that they'll look to review our proposed occupations as part of the 2027 update. If they are unable to find supportive data, they'll need to wait until the 2026, this year's census data, to become available late next year, and then we'll consider our changes as our requested changes as part of the 2029 update.
So the current systemic advocacy opportunities we have is that we've corresponded with the ABS OSCAR team about the importance of recognizing lived experience, creating a submission in response to the call for submission scheduled for March in 2026. We also want to work to educate lived experience peer workers on the importance of the information they provide on the census state, which is quite important to build the overall workforce capacity and understanding of where peers and lived experiences is incorporated into people's roles. Next slide. Thank you, Juanita. Will this work? We don't know. There's little clarity or uniformity in the roles and job titles of peer workers across the spectrum. So it's unlikely that the data review will find any supporting data in the 2021 census, and hence why we thought it was an important thing to be working towards incorporating more lived experience into the census. Next slide. So what's next? In March 2026, we provided a submission based on the National Lived Experience Workforce Development Guidelines and other supporting documents concerning the classifications of our work. Now moving into August, we're working to create messaging to be shared about how, passing on to Joe.
Just, I suppose, to carry on now to August 2026, created message to be shared about how to make sure your lived experience is captured in the census. Now, ongoing, participate in other quantitative and qualitative data collection concerning the lived experience, peer workforce, including the current mental health and suicide prevention lived experience peer workforce census.
Thanks, Joe. So what can you do to help? In the next census, we need to prove that there are enough lived experience workers to justify a job classification. So the next census is coming up in August, and these only happen every 5 years. In the census, you are asked on question 43 about your occupation. So it asks, in the main job held last week, what was the person's occupation? Here, it would be invaluable if you could put lived EXP in front of your title. So for instance, if you are a research officer, you would put lived EXP research officer. If you're a consultant, you would put lived EXP consultant, and so on. This allows all our data to be collated under one title that shows that there is enough of us to be classified. The reason why we've gone with EXP is instead of spelling out experience, is that we've tried it with longer job titles, and this allows people to fit their occupation in there. And so everyone in Australia has to complete the census anyway on the census night. So this is an opportunity for us where it's already something that we have to do. And I know for myself, sometimes it can be tricky to know what to say on forms. So this is a nice way, instead of fitting ourselves into the predetermined boxes, that we can follow some instruction on collective action that will make a huge difference to having flow-on effects. So if you are working in the space yourself, it would be awesome if you could consider putting that on your census form. And if you aren't, sharing that around to people that you work with. Thanks.
Well, so the point and why this matters, I think it's important that we understand why this matters to the movement and why it is important. It's not just to help out peer workers or peer professionals, but it's about
making sure that all our consumers have access to peer work, no matter where they are within their journey of recovery, but also where they are physically around the country. We find often we have some people who are regional and remote on this committee, and there's often much less access to those lived experience professionals, including peer workers. It's to amplify the efforts of the movement as well, and to have our unique skills recognised as expertise. It's to track this growth and distribution of the peer workforce, and to hold systems accountable for the inclusion of peer, and to provide hard data for those decision makers who truly believe that if you can't measure it, it doesn't exist. Thank you, everyone, for listening to our project today. As Steph said, it could sound a little bit technical, but the main thing is what we're trying to do is to make sure that our movement has the data we need to be able to advocate strongly for consumers' needs. I'd like to thank Ava, Carly, Jen, Joanne, Juanita, Naomi, Kush, Sophie and Martha for their ongoing work on this project.
Thank you so much to Justine and the team. And just to echo what Justine said, it really isn't just about peer workers. It is about building a future where lived experience is valued and resourced and embedded in every part of the mental health system. We're basically saying we are here, we exist, and we matter. So next is the Victorian CAG, and they will be mapping out how our policy systems respond or fail to respond to the structural drivers of loneliness. They're looking across income support, housing, community infrastructure, and mental health to understand where responsibility sits and where it gets avoided. I'd like to introduce Beck Rudd, Senior Policy and Systemic Advocacy Officer at VMIAC, to begin taking us through their project.
Thanks, Steph. Before I start, I'd just like to acknowledge the traditional custodians of the land where I'm coming to you from. That's the Bunurong and Wurundjeri peoples of the Kulin Nation. I pay my respect to their elders past and present and recognise that sovereignty was never ceded. So VMIAC's Consumer Advisory Group project focuses on the idea of loneliness as a system failure. The central problem we've identified is that the conditions shaping mental health and well-being largely sit outside of the mental health system, while the primary responses to that sit within it. So that disconnect is what we want to look at. So loneliness is often treated as an individual issue, but we are approaching it as a socially produced outcome. And rising rates of loneliness, I think, really reflect this broader pattern wherein social, economic, and environmental conditions are not adequately addressed. So overall, this project examines how national policy architecture distributes responsibility for the social determinants of mental health. It focuses on where coordination breaks down, where accountability is unclear, and where investment is misaligned, using loneliness as a case example to make that visible. So we began with a broad focus on the social determinants of mental health. This resonated really strongly within the group as a way of challenging the dominant medical model of mental health care and shifting attention toward the conditions that shape well-being. And then from there, we explored how these conditions translate into lived experiences of distress. Through those discussions, loneliness and social disconnection emerged as a really clear and relatable example within the group. It highlighted the gap between the large-scale structural forces that produce loneliness and the individualized responses that are typically used to address it. So we decided to focus on loneliness not because it's the only issue, but because it really clearly demonstrates this mismatch, and therefore it's a useful entry point for examining how policy responds to socially produced distress when viewed through a structural lens rather than an individual one. So as I said, loneliness is often framed as an individual failing or pathology. The assumption is that the individual, the person, is not doing enough, they lack certain skills, or they need supports to change their behavior in some way. However, in reality, we know that loneliness is shaped by structural conditions. So these include things like poverty, income insecurity, unstable or unaffordable housing, insecure work, the erosion of community infrastructure, etc. And these conditions affect people's ability to participate in social life, maintain relationships, and feel connected to their communities. Despite this, the policy responses we see to the issue of loneliness are very frequently individualized. That doesn't mean they're completely ineffective, but they operate at a different level to the problem. They do not address the conditions that are producing loneliness in the first place. And I will pass to Melinda.
Thank you, Beck. So as Becca sort of outlined for us, you can see that there's a clear mismatch between the structural systemic drivers that produce loneliness at scale and the individualized responses that are designed to address it. So loneliness is shaped by conditions such as Beck touched on, housing insecurity, income instability, insecure work, and the erosion of the community infrastructure. These are structural issues that sit across multiple policy domains. Unfortunately, responsibility for responding to these structural issues isn't aligned with the structural drivers. And so the dominant responses that we see tend to operate at the level of the individual. And as a result of that, the system is focusing on the effects of loneliness rather than the conditions that are producing it. The system is relatively effective at managing distress in the short term, but not at reducing it or preventing it over time. And that's why loneliness will persist at a population level, even as we're seeing services expand. So how does the system respond to loneliness in practice? In practice, we're seeing people experiencing loneliness typically entering the system via mental health services or primary care or crisis supports. The response is generally delivered through short-term service-based interventions or clinical pathways, as you would expect. And not to take away from the important support that this may provide in the moment, but it doesn't change the underlying conditions which shape loneliness. And as a result, loneliness will persist, or we'll see it returning over time. What this does do is it leads to repeated contact with services without any sustained change in the person's circumstances. And we often see that loneliness is framed in two ways within the system. It's either a health issue, which directs responses through services and interventions, or it's an economic issue, and it's looked at in terms of productivity loss and system costs. In both of those cases, the responses remain concentrated at a program level, while the broader conditions shaping loneliness, those social determinants, remain unchanged. So when we look beyond services to the broader policy ecosystem shaping these conditions, it becomes clear that what we're dealing with is a highly fragmented system, and there's no clear ownership of the outcomes that are being produced. Responsibility would be spread across multiple portfolios, including the ones we've sort of looked at: income support, housing, mental health, and community infrastructure. Each part of the system is responsible for its own inputs, but no single part is responsible for social connection or well-being outcomes as a whole, which creates a system where responsibility is diffuse and accountability is understandably weak. In practice, what this leads to is siloed responses that are not well coordinated. As an example, if you consider supported housing that might be delivered, if that's delivered without considering access to transport, services, or community infrastructure, you have a situation where you're leaving somebody housed, but they're still socially isolated. These kinds of outcomes aren't the result of a single policy failure. It's how the system's structured. Because responsibility is fragmented, there's no clear mechanism for addressing the gaps between systems, and nobody is accountable for the outcomes that those gaps produce. I'll now hand over to another CAG member, Tom, to take you through what our proposed approach for our project is. Thanks, Tom.
Thank you very much, Mel, and thank you very much, Beck. Hello, everyone. My name's Tom. I'll be taking you through the last part of our presentation here today regarding loneliness. So how well does our policy system respond to those drivers? So having established that loneliness is structurally produced, the next question to ask is how well the policy system responds to those drivers. And to answer this, we're taking a diagnostic approach. So we're going to step back to examine the overall policy architecture, including how systems are organised and how responsibility is distributed across them. We're going to undertake a systems level gap analysis across 4 key policy domains that you can see on your screen. And that includes income support, housing, community and social infrastructure, and lastly, mental health. These domains capture the main areas shaping social connection, but they're governed separately and often operate with different objectives and accountabilities. Rather than proposing immediate solutions or redesigning the system, our focus is going to be on mapping what currently exists and identifying where responsibility is unclear, fragmented, or missing entirely. The aim is to make visible how the system is structured and where it is not set up to respond effectively to the drivers that we've identified. And this is going to provide a foundation for understanding the problem at a policy level before we move forward to solutions. So how will we analyse the policy ecosystem? So across the 4 domains that you saw on the last slide, we will map several key elements to understand how systems are structured in practice. And this includes where primary responsibility sits across levels of government, the key policy frameworks, agreements and funding mechanisms in place, and a dominant framing within policy, whether individual or structural. We will also examine how these settings translate into response in practice and how different parts of the system interact with each other. And through this analysis, we'll look at whether loneliness and social connection are explicitly recognised within policy and how they are positioned when they are. We're going to assess whether responses are primarily service-based or whether they engage with structural drivers and how coordination operates across portfolios. A key focus of ours will be identifying where responsibility is diffuse, where there are gaps between systems, and where accountability is weak or absent entirely. The aim is to make the policy system visible and to identify where it is not set up to respond effectively to the conditions shaping loneliness. So what is this project actually going to produce? So this project will produce a consumer-led analysis of national policy architecture. It's going to identify gaps in coordination, accountability and investment, and show where the system is structured in ways that produce poor outcomes, including persistent loneliness and social disconnection. Importantly, this work is designed to support national advocacy. It's going to provide an evidence-informed foundation that maps how responsibility for social determinants of mental health is currently distributed, where it is missing and where structural reform is needed. The aim is not only to describe the problem, but to create a platform for more coordinated cross-portfolio responses to socially produce distress. The project itself is also going to provide a foundation for the Alliance to build on, and whether this be for using the findings for advocacy purposes, expanding on the analysis into additional policy areas, or even going deeper into specific domains. So taken together, this is about making visible how loneliness is produced at a systems level so that responsibility can be clarified and action can be directed towards conditions that shape connection and well-being. That's the conclusion of the presentation, and just on behalf of VMIAC, thanking you all for tuning in.
Thank you so much, Beck, Melinda, and Tom. I think you've reminded us why consumer-led work is so powerful. Like through analyzing systems, identifying structural barriers, and proposing solutions grounded in lived experience, you're building evidence and, more importantly, demanding accountability. And it is so important for us to do it collectively. Cool. So now we are going to go have some of our panelists come up and answer some questions. I can see we've got some in the Q&A. Let me just quickly look. I think this one is for you, Justine. In regards to peer support work and the requisite training required, what are some of the ideas currently to differentiate peer training from other existing training for disability support?
Yeah, so I think that the overall approach is that what we're seeking to do is have peer work separated entirely from necessarily disability support work. While peer support work is one facet of peer work, the way that currently both the national framework and the WA framework have sort of imagined peer workers is as frontline peer workers. So there'll be a range of different frontline peer workers. This this also allows us to differentiate with us, because I think there's a very important point that we need to make within this, that not all peer workers are lived experience consumers. So there tends to be three main groups of peer workers. One is consumer peer workers, the other is carers, and there's the important category as well of Aboriginal peer work, which really needs to be defined separately and held accountable to traditional kinship models, to understanding, to the understanding and to the cultural practices of each particular country, and the right people need to be assessing that when it's happening. So what we're seeking to do is to have these broad brushstrokes that we can see where people are employed, and then within the modelling make sure that we have the space to put in specialities. One of the issues that we have is, of course, that no peer worker is called a frontline peer worker. They're called a million things, and that's one of the things that we're getting our head around. In terms of training, within the frameworks that sit currently, we definitely have separate peer work training. So we have separate training through the vocational TAFE system, we have through the skill set system, and also through the peer-to-peer modelling systems such as the IPS and other emotional CPR and these kind of training systems. And we would seek that all of those are recognised and that one doesn't necessarily oust the other. I hope that answers that question.
Thank you. And I'd just like to say you've got a few comments in the Q&A just saying it's a brilliant strategy for that you're working on.
I did see
another one about is there a slide or details that you can share information regarding lived EXP in the census so we can share it in the networks and the rationale to record this, please.
So what the next section of our course, what we have now achieved is making contact with ABS and having written the submission. Hopefully the next period will be a publication of the submission that we've written, just so that everyone else can have a look, but also to develop some comms to sort of get some stuff for social media to share around so that we can sort of communicate clearly what our messaging is. We do see that people do respond to this messaging really well. So, for example, the recent Social Research Centre peer workforce census, my understanding is that before the closing of that census, they had over 1,100 responses. So peer and lived experience people do respond well to these calls if we get that messaging out and if we get it out and if we get it right into the right networks as well.
And another one has just come in for you, Justine, as well. How do freelance lived experience consumer consultants, representatives, advisors without peer support training report in the census?
So one of the discussions that we had within the group was capturing the breadth of the different work within our submissions. What we tended to find within the frameworks and things was there was really, really detailed job descriptions of peer workers who worked as peers within the medical model. And then the job description sort of fell off the end of the earth. Our group sort of worked on putting a bit more structure around that and putting a few more words around that. But definitely we have asked for job descriptions such as policy professionals, lived experience policy professional, lived experience researchers, lived experience advisors, and lived experience advocates within those roles. I'm trying to remember if we did end up having a separate section for consultancy or we put it under another banner. But hopefully we did capture the breadth of what is happening within the peer lived experience workforce with their professions at the moment. And of course, all the work that we're doing is learning. So we're developing and nothing is final. And when we put forward, when hopefully we publish the submission that we made, very happy to receive positive and negative feedback on it because it is truly co-designed and having more people's voices is always useful.
Thank you. I think we have one for Beck. In terms of loneliness, visibility of this is critically important. How is this going to be achieved, and how do you contemplate engaging people to develop better connections in going forward with a reduced loneliness in our community?
That's a great question. Thank you. I agree. I think increasing the visibility of loneliness, particularly as a structural issue, is critical. And a key part of that is moving beyond this idea of simply awareness raising alone, and really focusing on how systems create or really prevent us making these kind of natural social connections. So as we said in our presentation, that's looking at the conditions that enable people to participate in community life. So secure housing, adequate income, accessible transport, inclusive public spaces, all of that. In terms of engagement, the focus for us is really about shifting this expectation from being on individuals to fix their own loneliness to putting the obligation back on systems to actually create environments where connection is possible and sustainable. So in terms of future steps, we are ideally hoping to come away with a really good systems critique of the national policy architecture that the National Alliance can potentially take up and do some further work with, whether that's going more in depth into some of those identified policy areas or expanding into additional ones, or proposing new policy frameworks based on that critique, or all sorts of options, really. I hope that answers your question.
When you map these different policy domains side by side, what kinds of gaps or inconsistencies are you expecting to find?
Yeah, I think we're expecting to see a fairly consistent pattern of how things are misaligned. So some of the gaps would be things like diffusion of responsibility. So no single portfolio is clearly, explicitly accountable for particular outcomes like social connection. Inconsistent policy logic. So one part of the system recognizes structural drivers, but another responds as if the issue is individual. That may even be within the same policy framework or portfolio. Investment gaps will be a big one, particularly in prevention and community infrastructure, and coordination gaps as well. So where policies exist but aren't aligned together. So even if there's good policy across different portfolios, if it's not speaking to each other, then it's not going to be effective.
So what would a more coordinated cross-portfolio response actually involve in practice?
I guess it's a part of that is better communication between different departments and different portfolios, but it's also about shared responsibility and aligned action and dedicated funding. So rather than this issue sitting just with mental health as if it only exists in the sphere of mental health, it would be a responsibility across every policy area. You would see aligned policy and funding settings, so different parts of government are working towards the same outcomes. Some shared accountability mechanisms, including things like how outcomes are defined and measured, which can often be quite different across different policy areas. And I think fundamentally it would be investment in the upstream conditions of this issue. So things like housing, increasing the rate of job seeker and DSP, and rebuilding and reinvigorating community infrastructure, I think would be key parts of that as well. Yeah, and I suppose thinking as well, shifting how we think about intervention away from mental health services being the kind of primary response, and more towards a recognition that prevention actually sits largely outside of the clinical system. Yeah.
How does this system level framing line up with what people actually experience on the ground?
I think for a lot of people, it lines up pretty closely. People, I mean, correct me if I'm wrong, but I think most of us have experience the system as being pretty fragmented. You move between services that don't talk to each other, don't connect. When you're maybe at your most unwell, you're expected to navigate these incredibly complex systems on your own. And even if you're able to do that, the support you receive, it often doesn't match what is actually causing your problem. So even though policy talks a lot about social determinants, people are very much still largely receiving individualized, service-based, kind of discrete responses. So yeah, I think really what people are experiencing here, it's not just a service failure, it's a system design issue. And the focus of this project is, yeah, really shifting that narrative away from this isn't working for you because there's something wrong with you as a person to actually the system isn't designed to respond to what you're dealing with and it's creating the issues that you're currently experiencing.
Thank you. Oh, we've got another one for Justine. Our participant says, my personal goal is uh, use my specialist community music making knowledge and experience when I work as a lived LLMH peer worker. Do you see a space for this in the future? They're currently undertaking a Cert 4 in peer mental health, not liking the curriculum and methodology at all.
I think there's a lot of space for a lot of different methodologies, and I think that when we write these job descriptions that we hope to get recognised by in the OSCA systems. What we're trying to do is keep them as broad as we can in terms of the recognition of the skill of lived experience is it's within its own identity. It's not necessarily entirely tied to those certifications. So certifications can be really useful for legitimizing and work in a way, but often self-organizing and self-teaching has been the way that peers have found their ways into less oppressive ways of recovery. This is particularly highlighted when people are dealing with colonial load, when they're dealing with being ostracised from systems, and we have to make sure that what we're not doing is essentially replicating respectability within the system, but we're actually carving a space for something new, and that this data is used to help carve that space for something new.
Thank you. I think you guys both answer questions so well. So I'm glad that you guys are on the panelists and knowledge experts in the projects you're doing. I think that's all the questions we have for today. The next consumer-led conversations is scheduled for the 26th of May from 5 to 6 p.m. Australian Eastern Savings Time. We ask if you want to complete the evaluation form. It'll appear up on your screen when the webinar ends. We will also email it to you in a form later this week. And as this is a new series, your feedback is vital to making conversations a success. Finally, a recording of today's conversation will be available on our website, nmhca.org.au. And for those of you who are mental health consumers, I encourage you to join your local peak body if you do not have the details, if you haven't already, but the details for each peak will also be on our website. To hear about the future of consumer-led conversations, please sign up to the Alliance's mailing list, which is also available on our website, or follow us on social media. Thank you to all our panelists for their time today, and to all who joined us for this event. Thank you and bye for now.